Hey everybody, how's it going? Dr. Dave.
Dr. Zach.
And we're with Stronghold Health. Today we're going to be doing a soft wave therapy treatment. If you've been in our clinic, you should know what soft wave therapy is. But if you don't, this video is definitely for you. And for those of you that are curious, kind of know what it is, but you haven't seen a treatment, this is also for you. We've been marketing this device as StemWave therapy because it's essentially a stem cell machine. It activates your body's own stem cells, but the actual technology is called soft wave therapy. So you'll hear us refer to it as both soft wave or stem wave, but it's essentially the same treatment. So it's this device here. It's a really expensive device from the UK. We brought it into this, well, we weren't the first one to bring it into the States, but one of the first ones to bring it in here to the state of Tennessee. So we're really excited. We've been seeing awesome, really incredible before and after transformations taking place with patients. Dr. Zach, what have you been seeing with some of the treatments?
I mean, I've been seeing immediate results as far as pain reduction, increased range of motion. We'll have patients come in here that can't lift their arm up past here. After one treatment, they'll be all the way up here. So it's really cool. I mean, my favorite thing about it is just the immediate effects we're seeing.
Yeah. So we have our wonderful Vanna White patient here who, as of 6 months ago, started having some issues with bending her fingers, right? So we're talking about which two fingers? The pinky
and pointer.
Pinky and the pointer. So the rock fingers. She's been going to too many concerts and her fingers are stuck like this and she can't bend them. But for about 6 months, it's really been bothering her. Are you having any lost sensation in the fingers? Any numbness and tingling?
No, just pain.
Just pain.
And swelling.
Yeah, and it's visibly swollen on the distal or the endmost portion of her pinky. It's her Dr. Evil pinky. We're going to get the machine all set up for the right settings on this. And the way that this machine actually works is clicks, and it's fancy. Yeah, so the clicking noise in there is actually a glorified spark plug that emits an acoustic sound wave. And that acoustic sound wave passes through water on the applicator head, which amplifies the speed of that sound wave from 800 to, do you remember how many?
3,300 miles per hour.
3,355 miles an hour?
Yes,
That's
sir.
super fast. Isn't that like 4 times the speed of sound?
I believe it is. Yeah, we're breaking the sound barrier.
So this thing has the ability to put acoustic sound waves as deep as a soup can depth into the tissue. And depending on the setting, for you, we'll turn it down so it's pinky depth. Basically what you're doing is you're putting the energy through the tissue and it's going to cause 4 main things to happen. The first one's going to be cuts, inflammation.
Right.
So that's great. If her pinky's swollen right now, you want to try and kind of turn off that inflammatory response so the body can start the healing process. What's the second thing it does?
It increases the blood flow to that area as well.
And healthy blood flow is great.
It's great for healing, yeah. We're bringing more nutrients to that area.
Oxygen, nutrients, everything the body needs to repair some of the cells. The third thing it's going to do is turn off some of the pain sensation for her, which I'm hoping is almost immediate. It doesn't happen with every patient, but some people it's like boom, night and day difference. 9 out of 10 on the pain scale before treatment, and right after they're like, wait, it was 0 out of 10, and they're like totally surprised. So hopefully that happens for you, no promises. And then number 4, the most important thing that it does is what?
It activates your body's natural healing response. So it brings your body's own stem cells to that area. That way, no external needles.
Stem cells are like the X-Men cells in the body. They can like turn into
the
anything.
mutating. Yeah, okay.
Well, they're not mutated, but they can turn into like anything. So
Right.
for her and her pinky, she might have some degenerated joint space there between the bones. So her body might need to repair part of the bone. So if the body's able to bring stem cells there, it can repair the bone.
Right.
Those stem cells could also turn into cartilage. They could turn into new blood vessels. In fact, this machine actually, really, really fascinating, regenerates nerves. So peripheral neuropathy and diabetic nerve patients, it's great for it. So anyway, the way this works is we're going to go ahead and put a paper towel down underneath your hand here. Yep. And then we're going to use this really cool stuff called ultrasound gel. And instead of freezing patients with super cold ultrasound gel, we have an ultrasound gel warmer.
Oh.
So we're going to put a little bit of ultrasound gel right here on your pinky. And we should say, for this, we're looking for areas of tissue damage. So when we do the treatment with you, if you don't feel it anywhere, there's really no damaged tissue. Because the machine, the device, it does not damage any healthy tissue, right?
Right.
So if we're running it all the way down her arm and she doesn't really feel anything, then there's no problems. Your job for the first half of the treatment is just to tell us the spots where you feel it.
Okay.
It might not just be the pinky, it might be all the way up here in your wrist for all we know. But we use the device to really tell us that. And we like to say if you can't feel it, your body's not going to heal it. So we're looking for spots ideally to mentally pre-frame you on this that'll feel like 6, 7, maybe even 8 out of 10 on the pain scale.
Okay.
But it's just a brief second in time so we can find that spot. And then the second half of the treatment, we'll come back to those spots and actually treat them.
Okay.
Okay? Thank you, good sir.
Yes, sir.
Are you ready?
Ready.
Let's blast that tissue with some healthy energy.
Wow. Yep.
Oh, what setting did you turn it on?
We can go down to 6.
Yeah, just turn it down to 5 for it being her first time.
Okay.
Would be nice to her.
In there, yeah. Yeah.
Right on the pinky?
Yeah.
Okay.
There too. Just a little bit there. Oh, there too.
So a little bit on your ring finger as well.
That's right.
And you do a bunch of videography, right?
Yeah.
Always messing with cameras.
Yes, and editing, I guess so. Yeah, because I feel
Lots of
over
computer
there.
work, huh?
Mm-hmm. That's okay.
So we're going to try and go through about 200 sound waves just to map the area here. I should have asked you for your pinky, how much 0 to 10 was that hurting
Yeah.
before treatment?
Oh, right there in that. Oh, there. Yep.
So what was your pain level before?
If I were to touch it, maybe like a 7.
Okay.
But if you were to touch it, it would be if someone were to knock it or
Right.
pull it, that hurts here too. Wow.
So as you can see,
Ooh,
it's really not that bad.
no, it's all right. But whoa. Oh,
But if you ever walk by this room and the door's closed and you hear it clicking
Ooh.
and you hear people screaming, we're actually helping them.
That is crazy.
All right, so you're at about 250 waves. We're going to do 50 waves. We're going to turn it up to power level 6, just 50 sound waves, and we're going to go back to those 3 spots that hurt the most.
Okay.
Cool? We're going to try and hang out on them for as long as you can tolerate, ideally 4 to 5 seconds, and then I want for you to just go ahead and tell me to move if you want me to move.
Okay.
5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, breathe, and 1. And let's do 75.
Okay.
Down a little bit more, I think.
See, this is what happens.
Yeah.
I can't feel what she feels in her hand, and so often the patient will have to help redirect the technician, which might be one of the doctors, it might be one of our other team members that are trained to do the treatment for you. But if you can't feel it, your body's not gonna.
Yeah. Feel it.
That's right.
You
See,
got
she's
it.
already indoctrinated with the process. I love it. All right. And that's it. Now, direct pressure, you said 7 out of 10 before. What's that right now?
Nothing. I don't feel it.
0 out of 10?
Yeah.
Can you bend it? Not yet.
Yeah, but I couldn't do that. I couldn't.
Passive
make it lock.
bending, that's me bending it for you. What's the pain
It's
level on
okay.
that?
Yeah, that doesn't hurt.
You would have screamed before if I
Yeah,
did that.
it would have. Yes.
And so,
For sure.
great example of, for some patients, that's how quick the before and after can be.
That's cool.
Ideally, the next 18 to 24 hours post-treatment is going to be when you really feel the biggest improvement for reduction in pain, improved range of motion, simply because the sound waves and the energy turned off the inflammatory response almost immediately based on the research. Within about 45 minutes, you're going to have stem cells that are going to be coming to the area there in your pinky, also in your wrist, that are going to start that process of regenerating tissue. So it feels great for the next day, but the real healing is over the next 8 to 12 weeks
Okay.
when stem cells have had the ability to do their work.
Cool.
how many more treatments do I need, doctor?
Oh, how many more treatments?
That's a HIPAA violation. We're not allowed to tell you her treatment plan. But we will go through it with her, and we'll make recommendations. It can be anywhere from 3 up to as many as 10 or 12 treatments, depending on the body part, the number of sound waves, and the amount of energy we have to put through to treat the area. So anyway, that's our soft wave therapy. Hope you enjoyed. She didn't scream too bad.
Yeah.
Worked great.
All right.
Great job.
I'm up next. Let's get my wrist.
Cool.